So we're adding education to the environment and health mix. And we're being joined by a professor of education, Professor Duru Ajayalemi. He joins us tonight on our 2019 End of a Decade review. Good evening and thank you for joining us.
Thank you.
Now, I'd like to take a look at this background. Well, the challenge of basic education has been another albatross around the country's neck throughout the decade. Now, according to the 2018-2019 school census carried out by the Federal Ministry of Education, the number of out-of-school children was put at almost 10.2 million.
That's true. Now, this high figure actually caught the attention of the United Nations, with UNICEF also declaring that Nigeria accounts for more than 1 in 5 out-of-school children and 45% of out-of-school children in West Africa.
I promised that we'll try to bring the number of out-of-school children to about half. I must apologize, we have failed in that, but I believe we have put everything in place for the next minister to achieve this.
The immediate past Minister of Education, Adamu Adamu, sharing the reality of the situation of education in the country with a focus on the out-of-school children, which in this case covers those between the age of 5 and 14. The number is around 10.2 million, lower than the 13.2 million released in 2017. The picture leaves many Nigerians worried. It's a scene of children hawking when they should be in school, begging for alms or accompanying parents and guardians on the street as a means of earning a living. And for those who have crossed the hurdles and registered for school, infrastructure is a challenge. Children are seen seated on the trees, on stones, exposed to hazardous climate conditions. Classrooms which have seen much better days, with falling roofs, broken furniture, and even blackboards which defy the color. The Federal Ministry of Education released states most affected as Kano, Akwa Ibom, Katsina, Kaduna, Taraba, Sokoto, Yobe, Zamfara, Oyo, Benue, Jigawa, Ebonyi, and Bauchi states.
In Bauchi, we have about 1.2 million of children out of school, out of the 10 million, and Bauchi is ranked first with the number of out of school.
Before now, it used to be commonplace to assume that once the challenge of education is on board, attention turns to the northern parts of the country. But the trend seems to be changing, as southern states are also included in the most affected states.
Well, that's right. So let's bring in Professor Ajayalemi and get his thoughts on that report. Now, before now, during the security segment, we had the security analyst saying if we can solve the problem of education, then we'll have solved the problem of insecurity, especially because, you know, these young children will have gone to school, will have something better to do. But I'd like you to give us a review on how well you think we have done regarding education and ensuring that, you know, children at different levels are well enrolled, and this means, you know, better human capital development for the country.
Well, I would not say that we have not done anything about basic education. That is why we set up the Universal Basic Education Commission, and we have state universal basic education boards. The Universal Basic Education Commission is supposed to fund education at the basic level. And this they do in conjunction with the states. States are to provide counterpart funding for what the UBEC releases to each of the states. Well, the problem we've had is that the money is sitting down at UBEC. Most of the states, or many of the states, are not accessing the funds.
How so?
Because many of them are unable to provide the counterpart funding before UBEC will release funds. And also, those of them that have taken the funds, they have not been able to retire such funds. So we have funds sitting down in UBEC, and we have education suffering. Infrastructure is a very poor environment for teaching and learning. The teachers are not well paid. Also, the pupils themselves at that level, they are not well motivated from the home, because the home should also work in conjunction with the government to be able to get the proper education. They needed to provide certain inputs, and the government is also expected to provide certain inputs. So all this has made it impossible for the standard of education to advance the way it should.
So, on education, all right, let's come to Dr. Joseph Onoja. If he said that the funds sitting with UBEC, do you think that these funds can be channeled into things that will work? Because it's obvious the strategy being put in place is still making those funds stay in UBEC. What if they're channeled into something else?
Well, I think there are situations where you have designated funds, and these funds have been designated for something. It's better to be used for that thing, except if it
Now,
will
when
be,
the thing is not working, what happens?
well, I think we have to look for a means, but we will not mind if you put in the environment. We need more money in the environment, yes.
So I think the big picture here is, so how do we now eventually tie it back to, I mean, the statistic we have out of school children, school enrollment, and so I think, shouldn't we change that strategy? Maybe,
exactly.
I don't know if environment will work, but which other area can we ensure that we channel it through such that we still make the gains we want to make in that sector?
Well, when we talk about the environment, even the environment, we have the environmental education component of it, which will also, because by the time you are able to teach the children right from when they're young, what we call catch them young, they'll be able to grow with that consciousness in their mind. And when they grow into policy, they'll be able to make informed decisions on things that will affect the environment. I think that's the area, that's the angle which I want to talk to you about.
All right. So I think it was actually meant to be Professor Ajayi Alimi to respond to that question, because obviously the strategy is not working for us. And we're looking at another decade in view. So 10 years passed, it didn't really work out. So if you could say, this is what we should do, this is how we should go about it, what would they be for you?
Well, I think the National Assembly will have to amend the UBEC Act to provide for UBEC to release funds, even without, to channel this to particular programs in the school system, rather than waiting for the states to retire whatever they are taking. I think it's part of the accountability that was built into the Act, that the state should be accountable, UBEC should also be accountable. But in the face of it, we have the funds that are there that are not being released, and the education sector that that the basic education sector that is to be affected is still suffering.
All right. Hold your thoughts on education. Let's talk about health, which we'll be talking more with Dr. Ajayi Arigbagbo. But let's see, when Ebola came into Nigeria, Nigeria had to battle many daunting challenges, we know, during the decade, including insecurity, economic downturn. Now, the country was caught unprepared when one of the deadliest health menaces known to mankind, the highly infectious Ebola virus, for which there was no known prevention or even treatment, threatened the nation back in 2014. An infected Liberian man called Patrick Sawyer actually brought this disease into Nigeria when he flew into Lagos on July the 20th, 2014. It took the heroic efforts of Dr. Stella Dadevo of the First Consultant Hospital to avert this disaster. Some people were also involved in ensuring this didn't escalate more. when she physically actually restrained Mr. Sawyer from escaping. Although he died in hospital 5 days later, Mr. Sawyer set off a chain of transmission that infected a total of 19 people. 7 of those 19 people died, including Dr. Adadevoh.
It has been over 1 month since Mr. Patrick Sawyer, the Liberian-American, imported the dreaded Ebola virus to Nigeria. So far, 13 cases, including the index case, Mr. Patrick Sawyer, have been confirmed in the country.
As I speak to you, Nigeria has only 1 confirmed case of Ebola virus disease, a secondary contact of Mr. Patrick Sawyer's and spouse of one of the physicians who participated in the management of the index case. She is stable, but still on treatment at the isolation ward in Lagos.
Meanwhile, out of the 257 under surveillance, 129 have completed their incubation period without any trace of the disease in them. Another 128 persons are still under surveillance. The government appeals to citizens not to be relaxed with the successes recorded so far.
You know, in Nigeria, once you say something is under control, people just begin to get wild again. If there's any benefit we have had from the intrusion of Ebola, into our nation, it's been the public health benefits in terms of environmental hygiene and personal hygiene.
When the minister was asked to confirm whether the only case currently managed is a sister of the late medical doctor who treated Patrick Sawyer, this is what he said.
She tested negative. Repeat, she's negative. Repeat, she's negative. Repeat, she's negative.
Ebola has killed over 1,000 victims in Africa since the recent outbreak was discovered in Guinea 5 months ago. With death toll still high in some neighboring West African countries, treatment research and control efforts need to be intensified in the region.
And we definitely will be forever grateful to Dr. Adadevoh, late Dr. Adadevoh, and all those who put their lives in line to ensure that Mr. Patrick Sawyer didn't leave that hospital and this didn't get worse than it happened. But, Dr. Adeyeye Arigbabuwo, how prepared is Nigeria if this occurrence were to happen again?
Thank you.
Maybe not Ebola, maybe something even more.
All right. Well, we group all these ones in the category of viral hemorrhagic diseases. And as at that 2014, by Providence, I was the chairman of all the private doctors in Lagos State. And if you remember, the NMA went on strike. So the entire body of the Sawyer saga actually fell on me and my ESCO.
Wow.
And incidentally, Adadevoh was a member of my association, so a very active woman. I think if you look at the way we were able to cope this Ebola saga then, the various port entries in Nigeria, both the land, the sea, and the airport and all those ones, they were well manned, taking our temperature and doing all of that. And then we also taught, or we were reminded of the routine, which we all knew before, like hand wash and trying to avoid disposal of wastages or waste disposal anyhow. So we as doctors and we as health workers, as well as Nigerians, we do not need to say because we recorded success in 2014 that we have got everything right, that this thing could not knock on our door again. Our borders are rather, I don't want to use porous, but our neighbors are there who could easily peep in. And I think what we only need to do is to remind ourselves that prevention is better than cure.
Right.
And that we should always be at alert, surveillance. And you could see what Lagos State did there. You will also see what Nigeria as a nation did. And the international community commended the efforts of the Federal Ministry of Health and so on and so forth. I think what we need to do aren't going to be new things. Even from the schools we're talking about now, the hand wash, sanitizer, and all those things should be put in place. And then when you want to even receive your patients coming in, you should be guided from day one, not when another Sawyer on board will come. And to let credence to what my fellow great men here have mentioned earlier, you would agree with me that when you don't even remember that illnesses like malaria and other things like typhoid, diarrhea, and vomiting could keep these children, for example, out of school, which is one of the major areas we should look at. And when these diseases are there, who has bothered to know whether they are viral diseases, whether it's bacteria, whether it is airborne, whether it is anything? All we just see later is, oh, my children have come home, or my child has come home with Apollo. People, I mean, you know some of the features of Ebola that we saw at that time. You see anybody with red eye, you pick race. So, and I think we also have what we call the Basic Health Care Provision Fund, which is like the that we have been told about, that kind of a thing. And you see the health insurance as we have it today, you see how our own basic health care fund is being utilized. We are now introducing what we call health insurance under one roof. And what does that mean? The present ES of NHIS has brought up that innovation now. And what does that mean? Both the federal, the state, and local, all of us will come together under that roof to do what we call preparatory to good healthcare financing. Yeah. It is this same budget and financing that we use in preparing ourselves in advance for things like Ebola and other hemorrhagic disease coming in. You know, so we just have to be proactive.
Definitely. Let's bring in Dr. Badamasi here. And, you know, one of the fears during that period was the fact that a lot of our cities are crowded. And people were worried that, I mean, it just makes it easier to transmit Ebola from one person to the other, especially in a city like Lagos. And this is occasioned by migration. And you know, the debate is still on whether migration should be curbed, free movement of people. But when you look at cities like Lagos, even Kano, and you know, other cities across the country, how well planned are these cities? You know, environmentally, people say that it is taking a strain on the environment. So what should we be doing to ensure that our cities are well planned, such that when issues like this come up, it doesn't spiral into a major thing?
Well, thank you. I think one good thing here to note is the fact that cities, as the way they are a composition of planning issues and a composition of unplanned segment of the city. It makes it more vulnerable to transmission of certain diseases, especially when it comes to the personal hygiene of individuals one way or the other. But as a way forward, my thinking is that city planning or city authorities should take upon themselves that the structure of cities and housing composition, housing structures are inevitable issues that we need to look at when it comes to issues relating to healthcare delivery. And these are paramount issues that will save money, that will save finances, and that will cleanse us of the ravaging menace of things like Ebola. Yeah.
You were talking about emission, individual emission. I think you talked about smoking. You was the one. That's individual emission, pardon me. But then we understand that Nigeria is also meant to handle this nationally determined contribution. And it's a major environmental issue. That's emission on a larger scale, not just smoking. On one hand, are we meeting, you know, this target? I mean, we are signatories to some of these, you know, proclamation saying we'll ensure this is a target. First, are we meeting these targets? And are we ready to take the hard decisions? Because I understand that there are some hard decisions to take.
Okay. Yeah, so to give a bit of background, so these world nations who are signatories to the Conference of Parties came together and decided that, okay, these are a set of things they were going to do nationally that will contribute in the fight to climate change. So Nigeria also bought into that and signed into it. So Nigeria, we've domesticated it, and we even have, under the Department of Climate Change of the Federal Ministry of Environment, doing a good job on that. And we have looked at areas, the department looked at areas where we want to contribute. And these, we decided that Nigeria is going to cut unconditionally 20%, and then 45% with the help of international organizations. Now we're looking at areas, oil and gas sector, we're looking at energy, we're looking at transportation, we're looking at agriculture and land use and so on. Yeah, so these are areas that should we want to start working on. But one thing that comes out really hit us is the issue of gas flaring, because Nigeria is an oil-producing country. So issue of gas flaring. Even before this time, gas flaring has been banned internationally, but we have been moving the goalpost of implementation. Now, finally, we are saying that 2020, we will implement it. You see, gas flaring will have helped us as a nation. Now, not just talking about the environment, it will help us economically as well, to put more money in our pocket. But you ask the question, why are the IOCs and other oil-producing companies more, they are more inclined to pay the penalties than to do it? Now, it's been shown that short-term, it's quite an investment. But on the long term, it will benefit both the company and the people. Because Nigeria is, we are battling with the issue of light. This will have been a good way for us to have light. Now, if you talk about a lot of communities, it's been shown that 2 million people are 4 kilometers, at least 4 kilometers radius from gas flaring in Nigeria. And in fact, the recent report shows that in 2017, there was an increase. Now, by 2020, we are supposed to cut that down. Now, the problem is the government said they're going to do that. Now, let's hope that this will happen, because it will also help in Nigeria's contribution, now nationally determined contribution to fight against climate change, and it will also help to improve our economy. So if we are able to do that, it will go a long way to help us. And it will go a long way also to improve the livelihood of the communities that are living around these gas flares point, which is quite important. So, and other areas you want to look at is agriculture and land use, which is very important. If I let me quickly talk about that.
Sorry. Let's give Professor Duro Adeyalimi a time to talk about these. He's talking about climate change. It means that in education, I mean, teaching little children, as little as they are, what climate change is really about and the effect of climate change, because it's global. It's something that would eventually affect us. Is there a curriculum? Are there things put in place to teach these children in school what climate change is and the effects of climate change and what should be done to avert any disaster that's coming?
Well, there is no specific curriculum. The idea of climate change education has been infused into many other subjects called career subjects. So there is an effort, at least locally, to make our children to start learning about climate education.
Are those not the efforts we learned in school?
Well,
is there an extra effort now?
There is more. It's now more prominent in these subjects. When you were in school, we didn't have this problem.
Exactly.
But the problem has surfaced now, and it's global, and everybody is talking about it. So it's infused. The Nigerian Educational Research and Development Council has tried to infuse aspects of climate change education in the various subjects.
But that's when tertiary institutions are not on strike. That's another, discussion entirely, which has, of course, been a major debate during this decade, over the past 10 years. But I'm sure we'll talk about this in a few days to come. But I'd like to thank you so much, Professor Duro Adeyalimi. He's a professor of education. Thank you so much for taking time out to share your thoughts. At the University of Lagos, definitely. Thank you so much. And Dr. Joseph Onaja, he is the Technical Director at Nigerian Conservation Foundation. Thank you so much. And Dr. Adeyeye Arigbabuwo, who is President, Healthcare Providers Association of Nigeria. And finally, from Kano, Dr. Murtala Badamosi, Department of Environmental Management, Bayero University, Kano, also joined us tonight on the program. Thank you, gentlemen, for sharing your thoughts with us over the past, for this decade of the country.
All right, we'll take a short break, and when we return in just a moment, it's entertainment and sports. Stay with us.